Next question. Why should some people with epilepsy avoid Basil and Hyssop? Let's first talk a little bit about what epilepsy is. In order to have a diagnosis of epilepsy, you have to have 2 or more seizures unprovoked by an identifiable cause. What is a seizure? A seizure is a discrete change in brain activity, and it can be anything along the scale of an absence seizure, which is just zoning out for a few minutes, all the way to a full-blown tonic-clonic seizure, which is those jerky motions that you see on hospital-based television shows where the people are passed out and they're drooling and they're jerking. That doesn't always happen. Sometimes it can be as simple as zoning out. There can be a variety of seizures for triggers. Some people have seizures at specific times of the day or night. Lack of sleep can cause seizures. The presence and absence of alcohol, stress, poor nutrition, low blood sugar, flashing lights, excessive caffeine, and fever all can be triggers for seizures. In some people who have seizures, they choose to avoid oils that are high in alpha and beta thujone, 1,8-cineol, pinocampone, and camphor. Alpha-beta thujone, I've already mentioned Dalmatian sage, and I don't want you to get freaked out by this data. Let's keep in mind how much that people are actually ingesting to have the risk of causing seizures. In a rat, we have seen that when injected into the belly, Dalmatian sage at a dose of 500 milligrams per kilogram can cause convulsant activities and be neurotoxic. In a case report where someone ingested a swallow of sage oil, there was a risk of a convulsion. There wasn't a risk, there was an actual convulsion. And in a 44-year-old female who ingested 7 milliliters, there were convulsions that led to death. So the key is, again, to understand that essential oils are very precious compounds. It's not good to use 7 milliliters of it on our skin, in a dish, however you choose to use them. And I'm in the United States, so I'm talking about a wide variety of uses. And it's important for us to know how our products are labeled within our respective countries so that we can educate our members according to local regulations. Next, eucalyptus. Eucalyptus contains 1,8-cineol, and there's a hypothetical risk because 1,8-cineol alters levels of calcium and potassium within cells. It's very rare to have a seizure, even after ingestion of very, very large amounts of the oil. When I say very large amounts, I'm talking 26 milliliters in an adult and 10 to 15 milliliters in an 11-month-old. There has been one case report of an 8-month-old child who died after ingestion of 30 milliliters of eucalyptus oil. So again, use respect for the essential oils and don't ingest 30 milliliters of them. That's not a good practice to have. Next is hyssop. Hyssop has been researched since the 19th century because of the convulsant effects. It's been injected into the abdomens of dogs, rats, mice, and has been shown to cause convulsions. A very small amount, 1 milliliter, in a 6-year-old did cause a convulsion, and ingestion of 30 drops in an 18-year-old caused a convulsion. This is why hyssop essential oil is fitted with a safety cap and is not labeled in any country for ingestion. It's always labeled as a topical and aromatic, simply because it does have such high levels of pinocampone. Next is camphor. There have been 2 case reports of people ingesting almost 10 milliliters and 700 milligrams of camphor in a child 2 and 3 years of age, respectively. After ingestion of 5 milliliters of camphorated oil, a 16-month-old boy did die, and ingestion of 30 grams, that is an extraordinary amount of camphor, in a suicide attempt did lead to grand mal seizures. So you may ask, who cares? Young Living doesn't carry camphor oil. But the thing is camphor is the chemical constituent within basil oil. And much of the data related to straight camphor has been extrapolated out to basil. And so I am unsure if there is a direct correlation or if it's solely due to the camphor oil.